How's everyone doing this morning?
I'm excellent. How are you?
Hey, doing great. Looking forward to this.
Oh, good. I'm so glad to hear that. Yeah, I'm in Arizona, so it's pretty amazing. It's like going to be 75 today and sunny and all those things. So,
Perfect.
cannot complain.
Good morning, everybody. Sorry
Good
about that.
morning.
There was a
Morning.
technical difficulty. Well, good morning. Jen, you are the only person on the call who I don't initially recognize. So it's nice to meet you. Where are you calling in from?
I'm in Delray Beach, Florida.
Oh, awesome. Awesome, awesome. Well, the purpose of having these community calls, I'm Brad. I'm the founder of Dharma Doctor. This is Dr. Amy Serin. She's our chief clinical advisor. And the purpose of having these sort of Q&As is to create an open forum where we can sort of answer any questions that you might have about the tabs or about the company. And I'd love to start off just by asking really quickly, like, have you used the tabs? Are you familiar with the product? Um,
So yes, my therapist has a set. So this is actually, and I'm actually already like prepaid,
cool.
waiting for my own, which I guess should be shipped in April. Um, so I guess I could just ask my question. So we've been using them like a little bit in session. So the question I had, or we had, was if I was to like, so I'm not going to have them for like a month, say, if I was to borrow hers set like overnight, is that something that's possible? Like that I could pair them with my phone, or are her set, like when I get my set, can my husband pair them to his phone as well? Um, or is that, how would that work?
Yeah, so we recently put an update. So the answer is yes. Like you can
Okay,
pair with multiple devices. The difficulty is that it requires to go into pairing mode each time when you switch to these different devices, and sometimes that can be tricky. You have to hold down one of the
okay,
buttons for 3 seconds and release. We just did a firmware update that makes that a lot easier. So if your therapist has updated the tabs to the latest firmware in the app,
mm,
then, if you take them home, you'll receive a prompt inside the app to pair. And then when you bring them back, all she needs to do is forget the Dharma Doctor device from her Bluetooth settings. And when she opens the app, she'll also get prompted to reconnect. So
okay.
it makes it's the tabs are still really designed to be used by one phone, but we're making it easier to switch back and forth between different devices. So that'll continue to improve.
And
Okay,
Jen, if that's really tricky, it is advisable to use it with the app. But if for
great.
some reason they can be used without the app on three pretty universal settings. So without messing with someone else's app, you could borrow the devices and use them on the three or the six, one of the six pre-settings that's in the tabs without the use of the app. Now, the app has a lot of functions and things like that, and it's better, but that is a possibility as a last resort.
Okay,
Yeah. And get those things in your hands, right? Because it's
right.
really just stress relief in any moment. And,
Yeah.
if you're having a hard time going to sleep, if there's flashbacks happening, if the things that you're processing in therapy are coming up, definitely can use those to really mitigate that effects because the published research on this technology is a 62% reduction in stress in 30 seconds.
Right.
And
No,
that
she
was with
told me,
a
she's like, I never saw you look so relaxed. Like when they're in my
right, right.
hands. Like,
Yeah,
yeah,
yeah. And
yeah.
so, right. And so when they're in, and the cool thing is too, is that we want to re-baseline your stress switch, right? So like if you're kind of, if something happened, or if some of us are just a little higher strung, right? You think of your stress switch as being 0 to 10. And we want our defaults hanging out low. But if for some reason our default is higher, we want to reset that. And that requires some heavy use, like in the beginning, and then eventually we move to like spot use them or just to meet the demands of our stressful busy lives, because we all have stressors and triggers kind of coming in. But really when we're rebaselining that stress switch, we do want some like heavy use in the beginning, and it will be, I mean, it for some people it's honestly a lifesaver. So yeah. And I love that your therapist is willing to lend you theirs. That's incredibly like kind. So,
Oh, yeah, well, I'm begging, but yeah.
okay, okay. Okay.
No,
Um,
I'm
Well,
kidding, but
whatever works, Jen, whatever
yeah, no,
works.
I'm
Yeah.
kidding. I'm kidding. Yeah.
Yeah. But I think Brad also, don't you have an update on the shipping also as well
yeah,
for
so
the people
and
who are on hold?
Jen, just so you know, the tabs have left the factory. They're currently en route to our warehouse, and so we're hoping to
Okay.
receive them within the next week, and then we'll ship them
Oh,
out.
okay.
So you should have them either by the end of the month or beginning of April,
Oh, okay.
is when everything will come through.
Okay.
Yeah. Mm,
Okay.
mm.
Thank you.
No problem. No problem. No problem. Um, yeah, I guess, are there any I can talk a little bit about the tabs, but if you're familiar with them, Jen, everybody else I think on here is pretty familiar. Happy to answer any questions anybody else has though.
Yeah, I'm curious, for the other few people that are on the call, um, what brings you here and how can we help?
Yeah, I actually have a question. These tabs, they're so easy to use anywhere you want them. I'm curious, I've used them in the past, not these specific tabs, but my sessions are like 50 minutes to an hour. And I would say like 80% of that time is using the tabs. Um, is there any downside, like, because it's so available outside of the therapy session now with these wireless ones, is there like how long should people be using these, right? Outside, is there a a limit or a minimum, let's say, like to get like the most out of it? I'm just
Mhm.
curious.
Yeah, that's a really great question. I get that a lot, kind of what's the recipe for use here? And we want to kind of think about your stress switch, kind of like, you know how people monitor their blood glucose levels now, and they're just
Hmm.
monitoring all the time, and it's fluctuating like
Yeah.
this. Your stress is fluctuating like that as well. And so it depends on what the life demands from you and what's going on, with your stress switch. So if I'm in a situation where I'm in a prolonged situation that's going to cause me more adrenaline or more stress. So let's say I'm giving a public, I'm public speaking at a conference, let's say. I really have them on the entire time that I'm in that situation because they're regulating me during that situation because there's going to
Mhm.
be triggers all throughout and my adrenaline is high. But if I'm just kind of, on a walk and I think of something and it's really stressful, I might put them on for, turn them on for 30 seconds or a minute, and they work really quickly to kind of lower that trigger and the response to that trigger. And then I feel fine again, and then I can turn them off. So it really is kind of situation dependent. The good news is because we're not invading your body with a chemical, right? It's not that you can take it too far. What I will say though is sometimes when they've done their job and your stress is lower, and you're trying to focus really hard, like we use these a lot with kids doing homework, for example. They'll be like, okay, well, now these are a little bit distracting. And that's when they've done their job and you don't need them in that moment because a lot of times they can improve and enhance focus when anxiety is getting in the way. But sometimes if you're really focusing and if there's music on in the background or something else and you have that particular sensory input in that moment isn't necessarily helping with stress. And so then you can just turn them off. So sometimes you'll get people who are like, okay, I'm holding these, but now I feel like they're not, doing that. It's like they've already done their job and you don't need more of
Right.
it. But if you're tuned into yourself, you'll be able to know. And in therapy sessions, I do trainings now for EMDR therapists where we want them to use the tabs the entire session. And then the thing that we're adding in and pulling back is the eye movements. So,
Hmm.
because these are really lowering stress. And why would I sit there in a session for 20 minutes and tell my therapist all the things that are on my mind and just let my stress switch go up and up and up and up? And then
Right.
just spot use them a little bit. So we're getting therapists that are getting much better results when they are using the tabs most of the session with their patients because it's providing like a desensitization effect.
Yeah, that totally makes sense. I've also heard sessions going as long as, extended sessions or 8 hours even, right? And so I guess that makes sense. It really just depends on the situation.
Yeah, and I have an intensive today in my clinic for someone 3 hours, and we'll have them going the entire time. So I have more than one set charged, just just in case, in terms of just battery life and things like that. Because if it's on a really high fast setting, we want to make sure that the battery lasts. But yeah, we will have I will have it on the entire time except for breaks.
Oh, okay.
Mm-hmm.
You know what? I actually have a few questions that were pre-submit. Okay, so one of those is, are there plans to offer a desktop version for therapists who want to integrate Dharma Doctor into virtual sessions or telehealth? What kind of future tools or features are in the works that make it even easier for clinicians to use?
We are definitely exploring the addition of a desktop app. I don't know, Jen, if you've ever used sort of remote EMDR or any of those other services where it's like a light that goes back and forth, but we're exploring ways to integrate the tabs with that sort of desktop experience. Additionally, therapists will be able to save preset settings for clients, and have some sort of bookmarking presets to be able to, immediately go back to whatever works best for a previous client. We're actively exploring additional resourcing inside the app utilizing. Oh, cool. Um, yeah, we're actively exploring additional resourcing inside the app as well. Like we're using some cool sound baths and sound healing that goes along with the tabs. So we've done some custom tracks. We're doing some interesting stuff with AI to explore new protocols. But yeah, all of that is currently in the works.
I love it. I love it. And right now, my clinics do a lot of teletherapy. And as is, with the tabs as is, my patients will have tabs wherever they are, and they can hold them. And if, Jen, you're saying you're not doing EMDR. If your therapist, if you are a therapist that doesn't do EMDR, or if you go to a therapist that does not do EMDR, you can add the tabs for a better stress relief and desensitization, and it augments and helps any kind of therapy. So it's like
But that's what
technology
we're
augment.
doing, I think.
Yeah,
Yeah.
technology augmented CBT, right? And this is great because especially when you're on teletherapy, therapists are really, really amped up. It's if I've got somebody in my office, it's easier to contain them if they flood than if somebody's in, Tennessee and I'm in Arizona, right? And there's a worry there that a lot of therapists will shy away from teletherapy, and because of that, it decreases access to therapeutic services. So when we're doing them, just having the patients will have the tabs, and instead of having a light bar go back and forth for the EMDR, if they're doing EMDR, they can do eye movements and look to each tab, or they can pick 2 points and go across. So for now, that's how we're doing it. It's working incredibly well. And for patients who are not doing EMDR, just having them in their hands while we're talking, especially even first session doing history, like therapeutic model is a little bit outdated, right? Like you go in and for 50 minutes or however long, you kind of talk about everything that's been built up that you're really upset about or that you need to work in your life. Talk about raising your stress switch and getting really flooded, right? If we're doing, therapists are using the tabs during that first session. Now people are getting an active therapeutic benefit during that session. And then the next session they come in, some of it's desensitized. And I have a specific technique and we're publishing research right now on exactly like how many life events or targets we can actually even desensitize by doing nothing else other than just recalling those with the tabs in your hands. And it's really, really remarkable how that can collapse the time and the energy spent in therapy and give people really immediate relief. It's great.
Okay, I have another one that is pretty interesting. So we know BLS is effective for stress and anxiety regulation. So could it also be useful for things like preparing for medical procedures, dental visits, managing performance nerves in athletes? We know, of course, that it can be. So I'd love for you to chat a little bit about that.
Yeah. Yeah. So it's funny because the question, stress is so misunderstood that people think that like all these different situations are different. But to our nervous system doesn't really know, oh, this is a dental appointment versus a medical appointment versus I have to perform or whatever, right? Our nervous system is just reacting to its perceived threats. And as a protective measure, like if you've gone through a trauma and then something reminds you of it, it's trying to protect you by, it's like an early warning system. And so it doesn't matter what the content is. What it matters is if your stress is high, in that moment, we want to use the tabs to bring it down. And so a lot of people are using them for that, for dentist appointments before and during the dentist appointment. Anesthesiologists are using them before procedures to lower heart rate and lower stress, and people's vitals will actually improve. So if you come in and your blood pressure is 140/90 and your heart rate is pounding, and they use the tabs, they can actually get people's biomarkers of stress to go down, and then they theoretically have a better response. They're also using them in anesthesia clinics when people come out of surgery to lower the stress, and then they seem to have better outcomes. This is not published yet, but they actually get out of the surgery centers faster, and it saves the surgery centers money, and then they don't have they have better outcomes coming out, because remember, stress is modulating all of the physiological factors in your body. So to the extent that we're lowering it, it's much better. The other thing we want to do with medical procedures is we want to make sure that they do not become phobias. So my kids are a good example, right? They were pretty phobic of needles, right? And they got to go in if they get their vaccines or if they're getting blood drawn or whatever else. If they have the tabs in their hand, not only does it go better, but don't forget, when you're stressed out, this changes your circulation. So for people who have a hard time actually getting their blood drawn because of stress, because they can't get blood out, if they have the tabs in their hand, it actually improves their circulation. This isn't published, this is anecdotal, but they can get a better blood draw. Isn't that crazy? But when you think about it, physiologically, it makes sense. And so for kids, we don't want them to have a needle phobia. So if we're using the tabs when they're little, they will not develop that. So we can essentially use it to prevent phobias, prevent PTSD, prevent these things. And I know, Brad, you as a company can't make those claims, but I as a doctor can tell you that that's what's going on. So, and Jen, I see your comment. I don't know how parents live without these. I have 2 sons, and I mean, we're whipping these things out all the time, right? Everything from I'm nervous to ask this person out on a date, or I'm nervous to compete. And actually, my 17-year-old had pretty extensive social anxiety. And with the use of the tabs over time, he was able to overcome this, so much so that we're actually going to a conference in Los Angeles in 2 weeks. And he and I are presenting on how he overcame social anxiety. And he's 17 and he's presenting this to about 50 people. So the thing about using the tabs, it's not just about me being a little less stressed. This changes people's lives, because what they'll go into, what they'll risk, what they'll actually, do in performing and, taking that shot, right? If they're anxious, it's gonna make them retract. But if they're not anxious, they're gonna move into their lives with some zest and with some courage, right? Because the opposite of courage is really stress when you think about it. Yeah, Jen, I think he may need his own. Listen, we've got rotating sets going on. And, yeah.
Well, my son is turning 22 next month. He's a
Okay.
senior in college.
Yeah.
But he was diagnosed with a autoimmune disease 6 years ago. He has
Oh,
Crohn's.
Okay.
And he had like when you talk about needle phobia, he had a severe needle phobia.
Yeah.
And like part of the treatment is, injections. And first you need like the baseline blood work. And if I tell you, we did like everything that you could possibly do. I mean, my pediatrician was even willing to like go to an outpatient treatment center and put him under for a minute to get the baseline blood work. Cause
Yeah.
I mean, I had labs come to the house to get the blood work.
Yeah.
Like he had such a phobia. It was just in his head. It was just like the unknown fear of the needle. Now
Yeah.
he could go and speak about overcoming phobias because he just like did it. I mean, I was bribing him. I was like, I'll give you $1,000. Like, I was like,
Yeah, good.
I was like, whatever
Whatever
it takes.
works.
My husband's like, I'll do it, you know, but he like, finally, he just mind over matter and did it. But he still has severe anxiety and
Yeah, yeah, and I'm sorry, you know, that really when we think about the impact that this can have on our family and our friends and in our work environment and everything, everybody is suffering more than they need to suffer. And this is just this inexpensive, beautiful way to improve the human condition in profound ways, right? And so we can all go back. Once people discover the tabs, the number one thing I hear is, man, I wish I had this in this situation and that situation and this situation. And it's like, right. I mean, but now you do, right? And really thinking about how this can help. And, you know, one thing we don't talk about that much too is memory and what stress does to memory. So even when we're talking about these medical things, remembering, like if you go to the doctor and you're stressed out and you just got a diagnosis, like, and I'm sorry, your son going through Crohn's and everything, and then you're listening to the doctor, it's like the Charlie Brown teacher, wah, 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 and you get out of the appointment, you go, I don't even know what he just said. I don't know what's going on. And, you know, unless you remember to put your AI on and it's giving you the summary, even then you're like, you know, and probably might not even remember to do that. So if you have the tabs on in those stressful situations, it can modulate stress and then memory is not shut down. Okay, so this is true for test anxiety and taking tests. This is true for medical appointments and these situations where you really need to remember things. And the other thing, Jen, that's really important, because both of my sons, by the way, have rare genetic disorders and they have a lot of pain. They get pancreatitis. Um, I was able to keep my kids off of opiates, which is very common for them to be addicted to opiates with their particular condition, with the use of bilateral stimulation. So much so that now I'm speaking in this community and I'm getting referrals from patients with chronic pancreatitis. And I just had one the other day who may not need to get their pancreas removed because pain is one of the reasons why they make the decision to remove the pancreas, and this person's no longer in pain. Because when you lower the stress switch with the bilateral stimulation, pain is modulated. Isn't that crazy? Right? So it's just, I mean, when you really contemplate how this one beautiful technology can change people's lives profoundly, and you're using it in these situations, it can really be a miracle. And we did have a question too about like, I think it disappeared on me in the chat. Let me see. Oh, my therapist had to do an evaluation to see if I qualified for EMDR. What are the qualifications they're looking for? Okay, so the question of who can do EMDR, the therapist is really wanting to know that they're not going to flood you and that it's safe so that you're not going to pull up all this distressing content and you're not going to stay distressed and decompensate. The thing is that a lot of therapists are doing this without the use of tabs. When you're doing eye movements in EMDR, it can be very, very flooding or very stress provoking. But I have not had a case in, you know, I used to have the wired versions of similar technology, and I have not had a case in probably 13 years of someone flooding and not being able to do EMDR. And that case was before we had the wireless versions to use outside of the office. So sometimes therapists are a little bit gun shy in doing EMDR, but it's typically because they're not maybe understanding or they haven't been trained on what the tactile bilateral stimulation is actually doing in the brain and how to mitigate those effects. So unless people have like really, really severe trauma growing up, I'm talking like their parents were in a satanic cult or they were abused their entire lives and they really can't cope and hold down a job or have relationships and they've got, you know, schizophrenia and things like that. I mean, unless someone is very, very compromised mentally, then they're probably just a fine candidate for EMDR as long as the therapist knows what they're doing and then they're using the bilateral stimulation. Okay. So we have another question. Some people think bilateral stimulation is just for relaxation, while others say it actually rewires the brain. With Dharma Doctor, what is really happening when someone uses it? Do the benefits come from just nervous system regulation, or is there something deeper going on in terms of memory process and rewiring? Okay. This is where I have to do a little bit of education on how the brain works. Okay, the brain is not a passive organ that's just like accepting things. The brain is an integrating organ. So the brain is integrating what happens in every moment, and the state of your brain dictates what happens to incoming information. So when I'm relaxing myself and the tabs, it's very important because you can be stressed out about something and then listen to your favorite song or go out for a walk or whatever, and then your stress slowly goes down. But then when you think about that same thing again, it's just as stressful. You did not get what we call a pattern interrupt. But the tabs work so quickly, it gives you a pattern interrupt, because what happens in the brain integrating is something stressful is triggered and the stress goes down so quickly that that's the brain's new paired association. And then the next time you think about that thing, it's not as stressful ever again. Okay, so it creates a ceiling effect. So the answer is both. The way the tabs relax someone, the way the tabs lower stress, because it's so quickly and because of the mechanism of action, and how the brain processes it, you actually do get a quote unquote rewiring in terms of a pattern interrupt. And we measure this over and over and over again, where we get something called a subjective unit of disturbance. So when I think about, this thing, when I think about getting in a car accident last week, right, it's a 9 out of 10. Okay. Then I put the tabs on, my stress goes down to, let's say, a 4 or a 5 without me doing any other work. Okay. Then when I think about it again, that car accident, it's maybe at a 4 or a 5. We can measure that very quantitatively, and it doesn't go. And when I say try to get stressed out about it, maybe it goes up to a 5 or a 6, but it never goes up to a 9 again. That's the rewiring that we're talking about, where your brain's automatic response to the same trigger, thinking about the car accident, has changed. And it's never goes back. And this is the basis of all healing. It's desensitizing something that was stressful before that isn't stressful now. So Jen, to your point about your son having this needle phobia and something kind of overcame it. And sometimes just repeated exposure can do that. I just have to keep doing this and my body gets used to it, right? Although sometimes repeated exposure can flood us even worse and make it worse, right? In his case, it got better, and I'm thankful for that. And I'm sure you are too, right? But desensitization is one of the bases of healing, and so is something called exposure with response prevention. I'm exposing myself to the trigger, and then I'm preventing the same response. And that's what the tabs do. They prevent the same response. In other words, my stress is a 9 each time I think about it, but now I'm preventing that. Now it's a 4 or a 5, and now that gets locked in as my brain's neural habit, and that's how we can spontaneously heal from things without having to talk about it for hours and hours and hours and wait for our nervous system to go down over time, because that's like a long, slow road, right? Like I wouldn't use a horse and buggy to go to the grocery store. I'm going to use my car, right? I'm going to get there a lot faster. And right now, unfortunately, in our field, we're kind of using horses and buggies. We're just relying a lot on talking and listening, and that's a very, very slow way to heal.
Jen, do you have any other questions today?
I was just typing it in the chat.
Oh, no
So
worries.
I might be saying this wrong, but if you're doing some kind of exposure therapy, would it be helpful, like when you're doing the exposure, to be holding the tabs, like with that?
Oh, yes.
Yeah.
Yes. I love you that you're making that connection.
So is that what
because
you were, I'm trying to like make sense, yeah, okay.
Yeah, well, right. So people with OCD, for example, or they're or even people with trauma, they're exposing them. Thinking about the trauma is technically exposure, right? Because you're thinking about it, even though we're not, putting you in another car accident. We're having you think about it, and your nervous system is reacting. The key to the response prevention in exposure therapy is the lowering of the stress. So if we have something that quickly lowers the stress, now instead of, I used to do the old way of like exposure with response prevention, and it would take me like 12 to 24 sessions with someone with OCD to like do one or two things. Now it takes me 1 session or 2 sessions because we have these all the time. And remember, exposure can be doing something, but it also can be thinking something. because the price we pay for having this, you know, big neocortex in our human brains is that we don't have to be in a situation to feel the feelings of the situation, good or bad. So yes, if you've got a therapist, and this is why I'm saying therapists beyond EMDR really should be using these tabs. If you're an exposure with response prevention therapist and a cognitive behavioral therapist or trauma focused cognitive behavioral therapist, and you use the tabs, these therapists are going to get much better outcomes much more quickly, and their patients are going to be less likely to drop out.
John, welcome. We're in an open Q&A, so if you have any questions about Dharma Doctor, about the tabs, feel free to plug them in the chat or jump on video. I'm Brad. I'm the CEO of Dharma Doctor, and this is Dr. Amy Serin, the Chief Clinical Advisor.
Hi, John.
Yeah. Any other questions from anybody?
And Bob, I don't want to put you on the spot, but love to hear from you if you have anything for us. And same thing, John, since you just hopped on.
No, I'm in a place where I can't do video right now, but I just enjoy hearing about this, and yeah, I just enjoy hearing.
Okay, good. Well, it's nice to have you. Thanks for joining. I do have one thing that that came up in the group of CEOs that I did the seminar for this last weekend, and in using the tabs during a prolonged situation, right? Like if I'm giving a a speech and I want them on the whole time. The tabs are connected via Bluetooth, and if your body gets in the way, then they will turn off. They'll lose signal. So for women, if they have tank top on, or even if they've got a bra too, they can put the tabs in the front here. And then in pockets, if you put them in the front of your pockets and they're not too far on the sides, they should stay connected, or in back pockets or in socks. You can actually place them, like if these are my legs, you can put them on the inside of the socks, and they should maintain connection there. So in situations where you want to be hands-free, but you want to leave them on, or if you're working or something like that, just putting them in areas where your body does not get in the way, that's going to be helpful. And then if they do turn off, some people grip them very tightly when they're stressed out. And if they grip them really tightly, it's so funny. We had all these CEOs this weekend, and one of them was like 6'5", and he had these just humongous hands. And when he would hold them really tightly, they actually would lose, but everybody else, they wouldn't. I'm like, you just have more meat in your fingers. So that's like getting in the way. But if they are turning off, just being a little bit mindful about how you're holding them or using them. And there's plenty of ways to do that, to where they're going to stay on in these situations where you want the technology to be on the entire time. So just a comment about that.
Great comment. Yeah, we recommend holding them like meditation stones so that the LEDs are visible, because that'll prevent anything from happening. But they should all reconnect as well. So, well, if there aren't any other questions, we will wrap. But thank you all for jumping on this morning. It was great. It was great to meet you, Jen, and great to see you, Bob and Fuyet and John and Michael. Yeah, feel free to email any additional questions if you ever have any feedback, or you can comment through the app. There's a feature request as well as a support page, and then you can also email us at info@dharmadoctor.com, and we'll always get back to you.
Thank you.
Thank you. So nice to meet you, everybody. Take care.
Everybody.